Hello everyone, we're Bro Health. Good to see some familiar faces and some new ones as well. And thank you for having us. My name is Brandon and I cover the San Bernardino area. And then this is...
I'm Nancy, nice to meet everyone. Hi.
And then I just have a quick slideshow to go over. We are a staffing agency that supports with school staffing, including nursing, therapy, and behavioral. So just a little bit about us. We were founded in 2013. So specialize in school health, our primary provider of nursing services to the largest districts in the country. And then as well, our big factor that we include is we have Michelle Beckman and Sahara as our clinical supervision, and then we also handle float pools as well. So last minute call outs, we always try to have a per diem float pool to cover last minute absences. We do have a small dedicated teams, always a phone call away. Hopefully get to talk to us directly, so no customer service or waiting or anything like that. You should be able to answer and someone will pick up. And then we're rapidly growing as well. It's been a crazy time. I've been at the company for 3 years, and it's wild the growth that we've seen, and we hopefully to keep doing that. Just a little bit about our core values. So this is our CARES value. We pretty much start with compassionate. So the compassion that our caregivers express for their patients is matched in every area of our business: adaptive, resilient, ethical, and service orientated. We really want to take care of our providers so we can take great care of your students. That's our main goal. And we really just want to be there for you, make sure your students are going to school, and be the best support system that we can be available. So some of our service locations. Let's go over statewide. This is some of our larger districts that we've been working with for quite a while, with different departments in our organization, with Elk Grove, San Francisco, Oakland, Modesto, Oceanside, San Diego, San Juan, and then my local area includes San Bernardino City Unified. I know Michelle Beckman worked there for quite a while, and I got to work with her a little bit when we were staffing there, and I had the pleasure of joining her on our team, and she's brought us so much value as well. And then Nancy.
And then some of the school districts, I manage the Riverside area. Some of the school districts that we do work with is Corona Norco, Riverside Unified, Murrieta, and Temecula as well.
Yes. And Sahara has been.
And Moreno Valley.
Shout out to Ginger.
Our main goal is comprehensive staffing solutions. We really want to tailor to your district needs, really understand the roles and responsibilities that comes with that. We want to offer flexibility in staffing options. We always want to be responsible. We do have a 24/7 on-call team, and we are on the phone all throughout the day, typically 8 to 5 or longer. We like to be available, and then we do have our well-trained, prepared, and qualified staff. We do include our 6-hour required orientation to go over MD orders, different services that we're going to be providing, and Michelle and Sahara leads those, and they've been awesome to have those with the team. Our main things that we staff positions are LVNs, RNs, and credentialed school nurses. Pretty much our differentiator that sets us apart are 5-hour LVN and RN training, like I just discussed. We do have an introduction to school nursing, credentialed school nurses training. We do have a credentialed school nurse cohort that we provide. We like to take registered nurses, new grads, get them through their training, provide them information how they can apply to the credentialed school nurse program, and we will pay for their certification and hopefully be part of a district and start their careers. If these registered nurses really want to be in the school industry, we believe that's the best thing that we could do to set them up for success. 24/7 service, like I said before. We're always hiring for per diem float pool. I know how the school year can be, and there's always last minute changes, so we're always going to try our best to have somebody out there to support your students. And then clinical supervision, evaluations, and of course communication between districts and ourselves. Our other branches that include psych and behavioral, exclusive focus on school-based ABA therapy, specialized in paraprofessionals, instructional aid, behavioral class aid, registered behavioral technicians, board certificated behavioral analysts, And yes, I'm working closely to our other area manager, Lauren Bracken. She just started her career in San Bernardino too, and we've been working closely with supporting behavioral throughout the school districts. I know it's been such a huge need this year, and their team has been growing rapidly with how many issues that they've been seeing, and we're just really happy that we're able to provide behavioral services to different schools. And therapy, of course, I know therapy is always a need in school districts as well. We always try to have flexible support to fit your systems and needs. Some of those positions include speech language pathologists, speech language pathologist assistants, occupational therapists, certified occupational therapist assistants, physical therapist assistants, and additional staff by request too. And if you want more information on therapy, my counterpart, Robert Lefebvre, is the area manager for that. So if you ever need support, you could email me directly and I could introduce you to the right point of contact for that. I know we always experience call-outs, and we will always do our best. We're up early AM in the morning, calling our per diem. So yeah, I mean, if you guys want to raise your hands, how many include call-outs at mostly, two times a week, and we're always trying to support your school district with qualified nurses to make sure that your students are covered. And then our main secret weapon, Michelle, Beckman, and Sahara. They bring so much value to our organization. We couldn't do without them, and our nurses really appreciate the support for sure. Because we handle the business side of things, communication, setting things up, scheduling, and all those credentialing and all those type of things. But we're not nurses, so we definitely need you guys to support. And then yes, we do require school nursing clinical supervision as well. We do have forms that we kind of assess our LVNs, RNs, CNAs type of staff that are on site. We do fill out this clinical supervision form to make sure they have what they need before going into the assignment, and make sure when they're on site as well that they have the support that they need. Professional development of nursing staff as well during their onboarding process. We do have initial and annual school training that we require, additional required training on tracheostomy and ventilators. We've been really working towards that. I know that's a huge need throughout school districts, and we always see those type of cases that are high acuity, and we've been really creating creative support on how we could train our nurses to be capable to handle those type of cases as well. So if you want more information on that, I can definitely supply that with you. And then ongoing nursing resources and monthly clinical supervisor meetings and services. There are opportunities for nurse leadership. We do have a company-sponsored RN to BSN program through Rasmussen. And then recently we've been doing the CSN cohort, which is kind of like I said before, an introduction to school nursing and mentorship programs, which can prepare RNs who want to take a next step in their career on becoming a credentialed school nurse for success in the school nurse role. And then, yes, we do have a pretty extensive onboarding process, but I think that is a good thing to make sure that they are experienced before going into their case. We are Joint Commission accredited, adherent to state federal regulations, and then as well compliance with HIPAA and student privacy guidelines, clinical compliance, and competency. So yeah, we make sure they're set up with proper charting, updated care plans and physician orders, and proper standards of care. And just a bit about oversight of nursing staff, pro health clinical supervision, initial school training evaluation, site visits and reviews, ongoing resource for questions, annual evaluations, and then a little bit on our side, our branch, proactive communication with staff, logistics and scheduling, and performance evaluations as well. We always try to create a relationship with our clients and our nurse staff. We really just want to support you guys, and we will put in our best efforts to make sure you guys are happy with our services that we provide. And just like a recap that we have, our main mission statement is to take great care of our providers for your students, and we want to learn about the challenges you are facing and create solutions that reflect the commitment to our values. But yeah, that was my little spiel. Thank you for taking your time to listen to me. And then as well, I would like to see if you guys have any questions.